All right. So, hi, Dr. Sanem. How are you?
Hi, I'm good. Thank you, Dr. Sarah. How
I'm
are
fine.
you?
Thank you. I'm great. So, today we're going to be doing a sample role play for one of the information gathering stations, the missing canine case.
Yeah.
I will be your
Yep.
examiner or your patient, and you would be my dentist or candidate. So, the
Okay.
scenario, you have it. And I will set the 3 minutes timer so you can take your notes and gather your thoughts. And then we are going to set
Yeah.
a 10 minutes timer so that you can start the role play. Once you're done, I
Yeah.
will give you my feedback uh, according to the
Mm-hmm.
criteria. And yeah, we'll take it from there. How does that sound? All good?
Sure. Sure. That
All
sounds
right.
great. Yeah.
Okay. Thank you.
Yeah.
Okay.
So, good morning, Mom. My name is Dr. Sanam, and I'm one of the dentists here. I'll be looking after Julia today. So, how may I help you?
Oh, thank you, Dr. Sanam. Thank you for seeing me in such short notice.
Mm-hmm.
So Julia's having a space in her mouth between her teeth.
Okay. So, can you tell me a bit more about it? So, which area is it present exactly?
It's in the corner left side of her mouth.
Okay. Okay. And since when is this gap?
It's been around 6 months ever since the baby tooth uh, had fallen out.
Okay. So, if I'm not mistaken, Julia is 10 years,
Yes,
right?
that's correct.
Okay. And mom, how did she happen to lose the teeth?
Well, that baby tooth became loose, and then it,
Mm-hmm.
eventually was lost, but then it was not replaced by another tooth like other teeth.
Okay. Okay. And mom, regarding, does she have any kind of trauma? Did she went through any kind of trauma, or was it just wobbly on its own?
No, she didn't got through any trauma.
Okay. And is this gap just on this side or on both the sides?
No, it's just one side.
Okay. And does she have spaces all around her mouth as well?
No, I believe it's just in that area.
Okay, and how is it bothering Julia, and how much are you concerned regarding this? Is it just the looks? Is she having difficulty in eating? What's the main concern?
No, she's not having any difficulty eating. It's just the look, and to be honest, I'm quite concerned that
Mm-hmm.
she will have this gap forever.
Why do you feel
Well,
that?
because her father has a similar issue, and I'm just
Mm-hmm.
concerned like she's gonna have the same
Okay.
problem.
Okay, we'll definitely have a look into it, Mom. It's a really good thing that you got Julia in here today. We can do some investigations and try to find out what's exactly happening. I still have a few more questions to ask you. Is
Yeah,
that all
that's all
right?
right.
So, have you noticed these gaps? Have they been increasing in size or
No, not really.
any such
No,
thing?
no, I don't think it has
Okay.
increased or decreased. It's about the same.
Okay. And have you, by any chance, taken out any other tooth from around that area
No, the ones that she had, or no, the
apart
baby
from?
teeth nearby that were lost before, they got,
Mm-hmm.
replaced by
Mm-hmm.
permanent, more like the new teeth once, like in no time, probably in 2 months.
Mm-hmm. Okay. Okay. That's really good. And this problem before?
Oh, no, we haven't consulted any dentist.
Okay. Okay. Okay, that's absolutely fine. You are here today anyways, right, to see me. So I would definitely try my best to help her
Yeah.
out. And mom, while brushing and all, does she complain of any kind of gum disease, bleeding from the gums?
No, her gums are very healthy, and I really take good care of her teeth. I make sure she
Okay.
brushes them and
Okay.
stuff.
So you supervise her
Yes,
brushing, is that
yes, I
correct?
do that.
Okay, that's really awesome. That's really good. I know she's really young, and it's really good that you are making the effort to clean her teeth. So, which toothpaste do you use? Is it fluoridated or baby toothpaste for her?
I'm sorry, can you repeat that?
So, you have been supervising her brushing, right? So, is she using a fluoridated toothpaste as well?
Yes, the same
Ah,
toothpaste we're using, her father and I. Yeah.
okay. Okay. Okay, that's really good. And, mom, did she have all her baby teeth present?
Yes, she had a full set of teeth.
Mm-hmm. So she didn't. Did she have similar kind of gaps in her baby teeth, or
No,
how
no,
were
her
they?
baby teeth were beautiful. They were like fully, and there was absolutely
Mm-hmm.
no any space in there. Yeah.
Okay. Okay. So, have you by any chance consulted a braces specialist
No,
for Julia till
no.
now?
This appointment would be our first um, appointment with
Okay.
any dentist whatsoever.
Okay. Okay, that's awesome. So I just want to be sure on this. So Julia had really good set of teeth without any gap, and they were all well aligned. Am I
Yes,
correct?
very well aligned.
Yeah, and she. Okay, that's awesome. And she happened to have this tooth missing, and it started becoming wobbly when she started getting her front teeth.
Yes, that's right. That is exactly what
Okay.
happened.
Okay. 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 Thank you for providing me all those information. It was really helpful. Just some quick question regarding her medical history. Mom, how is Julia generally?
Well, Julia's very healthy kid. I mean, she's very active, and
Mm-hmm.
she has no medical issue at all.
That's really good. So, does she take any medication or any over the counter medication or prescribed?
No,
Did she have any childhood illnesses?
no,
Any kind of allergies?
no. Although her sister is
Oh,
allergic to
mm-hmm.
penicillin, but not her.
Okay. Okay. Thank you so much, Mom, for answering all my questions. It was really helpful. So I would like to do some oral examination of Julia. So I would be checking around that area with my mirror and probe, and I would also like to palpate around the gums for any to see whether there is any kind of bulging or not. And apart from that, I would have to take a very big X-ray, which is known as OPG.
Mm-hmm.
So it's going to show me whether the teeth is present or absent, or if it's present, it's in what position it's there and all. So it's really
Mm-hmm.
informative. It will provide me a lot of information so that I can explain to you better about Julia's condition. And I would also like to take some pictures for baseline record. And apart from that, I would like to take some model as well to see, to do some analysis and for record keeping. Is
Yeah,
that all
that's all
right?
right.
Okay, so do you have any questions for me, Mom?
Yeah, well, so what do you think, Julia is? What is going on with
Mm-hmm.
her? I mean, this tooth? Why is she having that gap?
Mom, see, there's something I would like to explain to you. She is 10 years, and this tooth in particular, it usually erupts around 12 years of
Mm-hmm.
age. Okay, so there's still some time for this tooth to come along. And the reason I feel that she lost a tooth early was because, as you mentioned to me, that all her teeth were really well aligned without any gaps. So, what could have happened is you see baby teeth and adult teeth. I'm sure you have been able to see the size, the difference in size. Adult teeth that are quite big. So, when there isn't any space, what happens is to create this space, the tooth, whenever they are erupting, they start pushing other teeth.
Mm.
So because of that, this tooth might have become wobbly. And obviously, we feel when a tooth is wobbly, then other adult teeth might be coming. So maybe that was the reason you removed it. And it was just trying to align itself in the arc, the adult tooth. And
Mm,
that was the reason for her that she might have lost this tooth. And we still have some time frame, you see, 2 years of time frame. So I still need to check, and I will be able to tell you whether the tooth is there. And as you mentioned, she also has a family history. So we need to check and see whether the tooth is present in the right position, or whether it's impacted or it's missing.
mm-hmm. Oh, so
Is it clear for
ah,
you?
yeah. So there is a chance that she would be just like her father, having that gap. Mm.
Yeah, yeah, it could be there, but you have your teeth, right? So she could have your
Oh,
genes as well. We just
yeah.
need to,
Hopefully.
yeah. So we just yeah, hopefully, so we can just. I would only be able to tell you
Mm.
after I do the X-rays. So
So you think
that would be
I've
really
done a good
informative.
job bringing her to the surgery today, right?
Yes,
Mm.
yes, yes. That was really good, and let's see how Julia goes ahead with the X-rays, and I'll be able to help you out.
All right. Thank you.
Thank you, Dr. Sarah. I know I still have missed out some things, but
No, it's all right. So,
okay, thank you.
very well done, Sana. Just managed to stop the timer. Is it stop? Okay, yeah, it stopped. So, regarding the general structure of any information gathering stations, as and we have discussed,
Mhm.
um, it's important to have a, a certain strategy for each
Mhm.
station. All right, but generally for information gathering,
Mhm.
we don't want to cross the line of just gathering information. And you have done that very well.
Mhm.
Sometimes examiner might try to, drag you into differential diagnosis, definitive diagnosis, or management, but you should
Mhm.
always stay focused and never be tempted to elaborate more than is required. However,
Mhm.
if the examiner is asking you about a possible diagnosis, like what do you think, you
Mhm.
can you can elaborate on it, but make sure you are telling it in the way that it's let's just wait the results of the investigation examination, and then we will let you know what is going on for sure. But here are the possibilities. If you're talking in the way as it's making it sound like in possibilities, but you're not sure. Never sound 100% sure when it's information gathering. That's number one, and you have fulfilled that criterion very well. Well done. Regarding you stick to the time, you were able to introduce yourself and allow for 2 minutes at the end for the patient to ask you questions. That's another good job you
Mhm.
have made. Okay, so you didn't need an extra time, like like the candidate you were telling me about, and
Okay.
you didn't finish too early, which means you still have more things to say, which
Yes.
is also great. And uh, let's go back. Now we have talked about the outside. Let's go in depth a bit about your case.
Yeah.
Now, this is a 10-year-old with a missing canine. Okay, obviously positive family
Yeah.
history, whatever depends on what the patient says. The information gathering
Yeah.
part regarding the chief complaint, when you were asking me the chief complaint, I always stress that ask as many questions as you could remember from the information gathering before
Yeah.
you move to the dental, medical, and social and stuff. So you have
Yeah.
asked the most related questions and the most important questions. All right. So you
Yeah.
started by telling me
Yeah.
what is going on, what brought you here today in an open-ended question fashion, which is great. That is one of the things you
Mhm.
have fulfilled from the criteria. Very important in information gathering
Mhm.
to ask the patient today so they can express the chief complaint in their own language. All right. And
Mhm.
then you ask more close-ended questions. towards the differential diagnosis. What else? Let's
yeah,
just try to recall what you have asked me. So, since when did it happen? Very important. You asked me that.
yeah,
What happened? How did it, how did it, how did this gap appear? All right. Is it increasing or decreasing? Because if it was decreasing, it means there's a future crowding problem. All right.
yeah,
Uh, is it a single or multiple gaps, just in one area, or is it in
yeah,
both, in all over her mouth? Did she have the similar issue in her baby teeth? That's very important to exclude
yeah,
generalized spacing, which is usually related to, multiple missing teeth, not just one, some kind of a
yeah,
hypoplastic conditions or whatever. All right. And then
yeah,
you asked me about the trauma, history of the trauma. Now, the thing with the trauma questions, Sana, when you ask about the trauma, don't specify to what area or to what tooth, because you want to exclude the possibility of any tooth lost as a result of trauma, not necessarily the
yeah.
C, the deciduous canine. Okay,
Okay.
is there any
Okay.
chance that she had
Yep.
fallen out recently or maybe
Yeah.
anywhere in time that caused her to lose one of
Yeah.
her teeth? Important. Did she have any of her teeth taken out by the
Yeah.
dentist? Also, another important question, as a
Mhm.
result of decay or as a result of whatever. Did she have
Yeah.
braces before? I think you missed that. You missed asking me about the braces.
I think I asked about the have you taken her for the or braces
Uh-huh. Yeah,
specialist?
but not for,
So you said this is the first
yeah.
time.
Um, yeah, sorry.
Okay.
So you did ask me, but I'm talking about braces, like braces that have led to formation of a gap, you know? I'm thinking about male
Mhm.
functional
Okay.
appliances, just skin caps or the
Yeah.
headgear or what's stuff, like those that create and cause
Okay.
expansion and contraction of the maxilla. That kind of braces I'm
Yeah.
talking about.
Yeah.
What else? Um, what did you ask me? What else I could remember? So any tooth loss as a
Gum
trauma? No, I'm
disease.
still talking about the chief complaint part. Okay, because
Okay.
the allergy and dental history, that's different category of information gathering. Okay, so teeth lost by the dentist, extracted by the dentist, or by braces,
Mhm.
or trauma. These are like the differential diagnosis for what could a tooth, why would a baby tooth or any tooth get lost. All right. Once you
Yeah.
felt you're satisfied with these questions, uh, like, is there any pain, for example, you could have asked, or is there any bulge in the gums? Like,
Okay.
do you feel or see there's any bulge in the area of that gap? Because if
Okay.
yes, it means that the tooth is in. Sometimes, it happens that for a 10-year-old, you can see the canine is underneath the gum, even if it's still
Yeah.
far,
Yeah.
you know. How about the other side? Does she have a
Yeah.
similar issue? What's the deal with the other side of her, the other tooth on the other side? Is it
Okay.
there? Is it loose? Is it a gap? And
Yeah.
you might want to ask, is there any pain or swelling or any discomfort, difficulty in eating? You have
Yeah.
asked me about that when you said the main reason for seeking the dental uh,
Yeah. Yeah.
consultation. So, is there any decay in her mouth or any complaints? She have fillings before? The reason why I'm asking, because
Yeah.
sometimes interproximal decays, especially at the posterior teeth, can create spaces because it leads to shifting of teeth, drifting, sorry. Teeth can drift in case
Mhm.
there's interproximal caries and deciduous teeth. All right. So that's about it. I feel there's nothing more to ask regarding this issue. And then your medical history was great, starting from the is she fit and healthy, and then tapering toward the medication and
Yeah.
childhood illnesses. Very
Yeah.
important. Now, if I didn't elaborate and said that the father is having a similar issue, obviously in the chief complaint, you should have asked me, what is there a family history of
Mm.
having gaps in the teeth
Yeah.
or tooth, spacing between teeth
Yeah.
or something like that? Obviously, you didn't have to because I have given you the free information that
Yeah.
her father is
Yeah.
having that issue.
Yeah.
Dental history was great. You asked me about, I'm not sure
Mhm.
you did ask me whether I take her regularly to the dentist or not. Did you?
You said it was the first visit, so that was the reason I didn't
Ah,
discuss Sarah
oh,
twice.
okay,
So
okay. I thought then
yeah,
you would asking me about the particular cause for that particular problem, not in general,
yeah.
And what I mean is, do you take her regularly to the dentist for checkups, like for fluoride application,
Okay.
for examination
Okay.
and stuff?
Yeah.
And what about her diet?
Yeah. I missed out on
Very
that.
important in the
Yeah.
dental history, or let's say the social history, her diet.
Yeah.
Although it may not be highly
Yeah.
related to the issue, but in information gathering, as we
Mhm.
know, it's to establish a full profile for the patient. Like, what is she eating? What kind of
Okay.
because
Yeah.
your responsibility as a dentist is to look from
Yeah.
different things, not just the particular problem the
Yeah.
patient is here for. So tell me about her diet. What is she fond of sugar? Because if yes, then you should one of the investigation stuff that you ask for a to fill out a diet sheet the next visit, so you can work on
Yeah.
with the mother about what she's
Okay.
because sugar is not good for teeth. You can highlight that, no problem. That can be extra thing, maybe not something you will lose
Yeah.
marks for, but I prefer you try to,
Yeah.
cover everything. And
I just feel like I'm always running short on time though, but Sarah, so I'm like, can I avoid this
yes,
question?
yes,
So that's the
exactly,
main
exactly.
reason
That's a great
regarding that.
strategy. That's a great strategy because
Yeah.
you cannot cover everything in 10 minutes time. If you
Yeah.
cover everything,
Yeah.
you might miss out on important things. You know what I mean? So
Yeah.
you better be
Yeah.
selective. And the
Yeah.
reason why you take 10 minutes, Sana, because your communication is very good because you give the patient the time to speak and to listen. You actually listen to me when
Mhm.
I be your patient. So it's not like you're trying just to catch up with time. No, you give me time, you listen to me,
Yeah.
which is great for your communication. I love it. All right. And finishing up with asking questions, going back to the coming to the investigation examination. So you have done that very
Mhm.
well. I will examine her generally all her teeth, and I will examine this gap. I will also feel around the
Mhm.
gums, palpate around the gums in case the tooth is there or not. And I will
Yeah.
probably take a model for baseline record and also to measure the amount of the space. And I will probably gonna take an X-ray, a panoramic or a full mouth X-ray. Either uh, either
Yeah.
one is fine. And once I'm done with all of that, we'll have another chat to tell you what is going on, and we'll take it from there. And you've
Yeah.
covered all that very well. And you have given me. So, do you have any question? That's great. Ask the patient what do they want to add because then you will have time to answer
Mm.
their questions. All right. I liked it that you
Yeah.
didn't refer to anything like she's a 10-year-old and she's perfectly normal and you left all that part to the in the where you ask the patient, can you tell me do you have any questions? I mean, I felt you were being so you're avoiding being assumptive and you're trying to elaborate free information that is not required. It might
Yeah.
take you down
Mm.
and like she's doing unnecessary diagnosis and management based on the history only, which we don't know, which we don't want.
Okay.
All right.
Okay.
So overall,
Yeah.
thumbs up.
Thank you, Dr. Sarah.
So, do you have any doubt or question?
Thank you. No, I think you just cleared out for me. So yeah, there are certain points I did miss out on. I'll just be mindful of those, like
Yes.
the discomfort, swelling, pain, and the other canine side. I think I did
Yes.
not take a proper history of that. That was really helpful for me. And yeah, diet, I'll definitely try to squeeze in, Doctor. I know I just want to avoid that because there are lots
Yes.
of other things, and I'm like, if I go into diet, I'll have to explain a lot
Yeah.
of other things.
Yeah.
So yeah, I'll try
Yes.
to do that.
All right.